I'm delighted to be here on Father's Day to talk about pregnancy. So I'm here today to share with you some of the research we're doing on prenatal care and how we can best meet the needs of women over this time in their lives when they're generally accessing more healthcare services than usual. Now, across Canada, the vast majority of women do access some type of prenatal care, but we know that the traditional way of individual visits doesn't meet the needs of all women. Women who don't have their prenatal needs met include those who are younger, on low income, may be non-Caucasian or don't speak English, may have a poor network of social support, or a history of abuse or domestic violence. So imagine for a moment Heather, a young pregnant woman in a low-income situation, trying to keep up with work or other children. When she has a typical prenatal care visit scheduled, she's most likely to have to leave work or take a day off and take her other children with her. She's likely to have to take public transit, which can take considerable time and can be inconvenient. At the office, she'll sit and wait for her appointment. When she sees the doctor, the visit will be over in about 6 minutes. And although she may take several more minutes for her to gather her thoughts to ask questions that she may have. So her questions may not be answered, and she may not be receiving the kind of support that she would benefit from. In addition, other problems like mental health or food insecurity may go unnoticed, and she may feel discouraged from making a future effort to attend this kind of visit. So I'd like to tell you about an exciting and promising type of prenatal care that we've been researching in Calgary called Centering Pregnancy. In this type of care, 8 to 10 women of similar gestational ages meet in a group setting with a physician and an educator. The group meets for 10 sessions of 2 hours each over the course of their pregnancy. There's 3 central components to this kind of care. First, women engage in self-care activities, including doing their own weight and blood pressure. Second, women meet with a physician in a semi-private area for an individual medical assessment, including listening to the baby's heartbeat and taking measurements. And finally, the women gather in a group to discuss concerns and questions they have about their pregnancies, labor, and early parenting with the educator and the physician and each other. Through this type of group care, women have a much more extended prenatal experience, as each session is about 2 hours compared to a few minutes. Additionally, they have access to a network of peer and professional support and many opportunities to raise their questions. While this type of care may not resolve all barriers to prenatal care, such as transportation, it does offer consistent and convenient times and locations where women can get more in one place at one time, and it seems to be better meeting the needs of many women. Our early research findings suggest the following. The women have told us they're getting more in one place at one time, and they're getting more than they even realized they could have needed during this time in their life. They say things like, "Everything I needed was right there." They also say things like, "A mother and a child told us, I tell everyone I've never had this much support, and it really helped. It's the first time I didn't get postpartum depression." The physicians are telling us that they felt they're providing richer care. They said there was a greater exchange of information, and they got to know their patients better. And they partnered with them in improving their own care. The educators have told us they're invested in the success of the women and the program, and they felt the support was transformational in the women, and it fostered a supportive community and bridged gaps in knowledge exchange and information. So in summary, we're really excited about understanding the value of group prenatal care and this model, and we've seen some very positive responses so far. Our further research will be looking at health outcomes, including preterm birth, breastfeeding, postpartum depression and mental health, and parenting skills and supports. So this has been an exciting project, and we look forward to talking about it further for the value of Albertans. Thank you.